Hi everyone. I just wanted to go through the standardized patient lab a little bit more in detail for all of you. So, how to prepare. Make sure that you arrive at Prior Library in the basement at your scheduled time. If you have any questions about your scheduled times, let me know, but you should be able to see those on Carmen. It broke you into different groups and gave you a specific time to arrive. The whole entire encounter is a total of 1 hour, but you get 30 minutes of that hour at the beginning to review all of the relevant information for your case study, to interpret the assessment results, and work on what you want to say to the family. You will not be given your case study before your start time. So you want to make sure that you arrive on time so that you get the full 30 minutes to review it and kind of prepare yourself for that encounter. The actual simulation only needs to be 10 minutes maximum. You do not have to use the entire allotted time. So it's likely that you can go in and accomplish everything that you need to in a matter of 3 or 4 minutes. But we wanted to make sure that you have plenty of time, that you can ask questions to the family or talk through things with them to make sure you're covering all of your bases. So you are not graded on the time requirements. You're only graded on all of the relevant information being provided and being provided in a parent-friendly, culturally sensitive way. So who are the actors? The actors will have reviewed your case and are aware of specific responses that they should provide to certain questions, and they will know certain reactions. They're familiar with your case and how to respond. These actors will be simulating your patient's parents or grandparents. So basically what will happen is when you come in, you'll review your case study, and it will be an evaluation that you completed with a child. It'll provide the results and some different observations. You can score the results of the assessment and use the observations provided to explain to the parents what you saw in your evaluation and then what your recommendations are. So basically, it's to simulate what actually happens in the clinics after you've evaluated a child. So in order to help kind of prepare for how to talk to these actors who will be portraying parents or grandparents of the children you're working with, I suggest that you review the Working with Families lecture, which will be posted next weekend, and then the page 186 in your OT for Children textbook. It's a really short read and it helps to provide some of the specific things that we will be looking for when we're grading. So what do you say to the parent or the grandparent of the child? Basically, you want to make sure that you're explaining the assessment, you're providing the name of the assessment, the purpose of completing that assessment. So why did you decide to choose the Bayley over the Peabody or the sensory profile instead of the Bayley or the Peabody? You'll also want to include the age range of that assessment. Does it actually work for your child? And then explain to the parent why it was done. So reiterating that purpose is really important. You want to make sure that you're using parent-friendly language and that you're culturally sensitive. Then you'll want to explain the child's scores and what those scores means. So you want to keep in mind that not every parent or grandparent has an understanding of what standard scores are or what the average scores are. So you will want to be able to explain what the average scores are, where they scored. I want you to also keep in mind these specific scores that we have discussed in class that you may not want to include depending on how the child scores. So that can be those age equivalencies or percentiles. And then lastly, you'll want to make sure that you're including your therapeutic recommendations. So if you think about what happens after an evaluation, you typically go in, you explain the assessment, you explain the child's scores, and then you're telling the parent what your clinical judgment says after observing the child and evaluating them. So you will need to explain, if you are recommending OT, the intensity that you're recommending. So if you notice there's some significant things that you'd like to work on, you may recommend a higher intensity over something that you may want to recommend every other week therapy for. Additionally, you will want to, if you're not recommending OT, you will also want to provide the parents with some things to work on at home. So obviously the parents are there because of some sort of concern from either themselves or the doctor. So you'll want to make sure that you're giving them something to work on home and things to look for once they're home. I just want to specify that We aren't expecting you to accurately be able to decide on the intensity or specific recommendations to work on. So you will not be graded for that. You're just graded for trying. So as long as you correctly recommend or don't recommend OT, and then try to recommend an intensity or some things to work on at home, you will get the full points for that. And we want you to do your best on that so that we can give you some feedback about if that's, if the intensity is appropriate or if there's something you may want to consider that may change your intensity and things like that. Okay, so then what happens after the simulation? So the first thing that I want to say about this is please do not leave prior and go talk to your classmates that have not yet completed their simulation. This will be considered cheating, and we want everyone to have a fair opportunity to practice this. This is really about getting the feedback necessary to grow as clinicians, and as long as you state the relevant information that's provided on the rubric, then you still will get all of your points. So there's really no benefit of discussing the case studies with anyone who has not went yet. And then after the simulation, you will be provided with feedback from the actors. They are looking for certain things as well as we are. So you'll be provided with feedback about how maybe they felt in that position or as a parent, and some positives, and then also some constructive criticism typically is provided for you. And then Dr. Persh and I will review your videos and provide feedback as well as your grades. And I want to reiterate that the grading is based on the rubric, so please make sure that you review that rubric. It's on Carmen. If you have any questions about those necessary components, please let me know. But we also want to make sure that we're providing you with additional feedback that can help you grow as an OT and facilitate your learning. So this can hopefully improve future experiences you have in these types of settings. And then the last piece is the case study. So you will meet with your group to complete the case study. You'll be grouped with other students who had the same case study as you in the simulation lab, but went at different times. And all groups will be released after the simulation has been completed by every student. So you won't know your groups for the case study until the last group has finished their simulation lab. The case study assignment allows for you to start working on that treatment planning piece. So you're practicing giving the results of an evaluation, and then typically the next step after documenting it would be to create your treatment plan for that child. So in order to do this, you are going to get together with your group and complete a literature search. You'll select articles with high quality evidence, and you'll select 2 effective interventions that address your patient's specific goals. So when you turn this in, you should have the appraisal forms from the articles that you reviewed, demonstrating that this is effective research or high quality research. And then you'll have a 1 to 2 page research summary describing what you found in the literature and ending with your 3 recommendations for the child based on the evidence you reviewed. So that's really everything. If anybody has any questions about the Standardized Patient Lab, please send me an email. I will be out of the country for the next week, so I will do my best to get back to you, but it may be delayed. But after spring break, I'll be able to talk to you more in person, and I'm always available via email or Carmen messaging if you have additional questions. But I recommend checking out the rubric that's posted on Carmen as well as the readings provided. Thanks.